Can posture affect our saggy skin? Hi, I'm Dr. Peter Minke. This is Minke Wellness. And I call this Pooch by Posture because how your body is oriented will dictate how the skin stretches, and you can end up with patches or spots where the skin is flabby, it's not getting good support, it's not getting circulation, it's not getting drainage, it's not getting lymph drainage, and physically it's getting dragged down or compressed because of posture. And so this is where there's this correlation that a lot of people miss, and they say, well, gee, I need to have this tuck or this trim, I need a facelift because it's sagging. And if it's sagging because of posture, then what you're doing is you're taking that tissue, tightening it up, and then securing that posture. And I'm going to show you what I mean here in a minute. But that could end up being long-term, really having consequences for the body and the frame. So let me give you an example of this in the face, okay? Because it's hard to see the rest of my body. But if my head and neck relationship is compressed, okay, and that would be considered inflection, and you see what happens to my chin and the tissue around my chin. So, it's just a postural change, right? All I've done is change my posture, and now all of a sudden this skin pooches out. And so let's say I was vain about that or concerned about that. I'm not meaning to say vanity is a bad thing. We want to look good, and that's a good thing. That's not a problem. But if I'm looking at this going, hey, there's all this saggy skin, and I decide, I really want this trimmed out, okay? What we're not making the connection is that the neck pain, the numbness, in the tingles in the hands, the headaches, the vision problems are all also related to this position, as the eyes have to start looking out the top of the muscles start to fatigue. There's a lot of cascades effects here, and so this relationship now is actually causing this, which is going to lead me to actions that are going to affect lots of other things. So let's say I go ahead and trim this out, and this is nice and tight now, and I pull this back and I get this nice and tight. Well, now what? So now let's say I go to a dentist or a chiropractor, and they say, the reason you're having those headaches or the discus is deteriorating is because of this head position. Let's bring that head position more neutral. Well, now I've got I've got nowhere to go. I've actually tightened this down to the point where I can't make this change back to normal, right? I can't bring my head back into a normal relationship because I've surgically changed this relationship, and I can't go back. And so now I'm stuck with this, which means stuck with deteriorating discs and neck problems, headaches, and all the rest of that stuff. So that's just one example. It can eye problems and this can occur in any part of the body. If I am, if my shoulders rolled here and I'm not getting good support, I may end up with flabby skin over here, or breasts that, if I were, man or woman, but the chest or breast would sag down because I'm in this posture. And so I think I need a tuck, I need a lift, I need something to help with that. And initially, like I said, there may actually be cause for, or in a way of thinking about this, that it would be a good thing to give that lift because that tissue is starting to break down, it's starting to become saggy, it's not getting good circulation, and so we need to cut it out. That's maybe not again, it's sort of a permanent solution to something that actually is more, there's other things going on. So how do I change the posture from here to here, okay, this relationship, and that's going to take some work, but it's worth the work. So I highly recommend seeing an Aston-Patterning practitioner, or getting chiropractic with massage work, doing your stretches and your toning. There's lots of different modalities that can help improve our posture, and we need to be thinking about that as part of our overall wellness. That's not something I can necessarily fix for you here. I do this work, hands-on work every day, and so it's I'm seeing patterns, different patterns every single day, different causes of these things every single day. And even within the same person that I'm working on, one session is not the same as the next. So it's not something that I can necessarily give you a couple videos on how to improve your posture, straighten up everything. I can talk to you about how to support your body in certain movements, like sit to stand and things like that, which are videos I've already done. I'll put a link in the description, but it's something to consider. It's, this happens around the middle as well. When we have this frustrating little spare tire, we've tried to lose weight, I still have this pooch. And I've worked with people that are like, hey, if I can't get to this, I'm going to go do surgery. And I say, well, that looks like it's compression around the waist. Let's get your body decompressed. Let's see if we can get you longer in your movements. So we release the outside of the edges of the legs. That's often, if uniform picks a few spots that you want to work on releasing. And can you do self-massage that's effective? Yes, you can, especially if you're using some of these Young Living massage products like the Ortho Sport or Ortho Ease, which I have here. So here's the Ortho Sport. You can see it's been around a while. And the Ortho Ease massage oils, and these are massage oils pre-mixed, enhanced with high quality essential oils that you can rub in and actually start to enhance the massage, get a little bit better release, and start to get into that tissue, improve circulation with the massage, and get it start loosened up. You can also do rolling. They have rollers, and what I'm saying is the outside edges of the legs from hip down to the knee and now all the way down to the ankle. Those are areas that are chronically tight for people. Hamstrings are chronically tight. Why? Because we sit, the way that chairs are designed, the way that shoes are designed, these are chronic problems. Most people could benefit from releasing outside edges. And then most people are too tight. Up here we're doing this, which of course you could see how that would have an effect on the way my skin looks and what areas of my body get circulation, how my skin. Okay, and you're going to say, well, wait a minute, I thought we were talking about skin today. This is all part of the skin integumentary system. Yes, that's what I'm talking about. Every organ gets affected by the circulation, and if I'm not getting good circulation because of posture, then I'm going to affect the skin. But there's also these aspects that I'm talking about of structural shape, right? This kind of thing, that you end up with these folds of skin that are clearly not going to get good healthy, good health, not good circulation and all that. But that's not caused by, it's not something that you have to fix it by fixing the cause of the source of the problem, which in this case we're talking about posture. So these changes of posture are going to be the answer to some of these things, and I caution people about jumping into some of these surgeries that would seem like, okay, it's going to be improved, it's going to make things look better, and that's definitely, for the most part, that's true. We've all seen some of those surgeries that have gone wrong, but but when you start talking about taking tissue out, you've made a permanent change to the fascial system, then you cannot change it back. There's not going to be any room for the postural changes that need to be made to protect the discs or protect the nervous system if you're getting numbness and things like that. So just something to consider. I know that it's not easy. I know that it's nice. It's very attractive to think, okay, just do the surgery and get and be done. But there's that other element. You say, okay, what's the best, most solution? What's the bigger solution? And the bigger solution definitely would be to get the whole body aligned and moving properly. And that's a lot of effort. It does take effort. I'll admit that. And that takes cost and effort. It might even take, in a way, more money than let's say, I'm just saying, let's say the focus is to fix this right here, and I've got to get 30 bodywork sessions in order to make that. And let's say the body, I'm just for the sake of math, let's say the bodywork sessions cost $100. They usually are more than that for longer sessions. But that's $3,000 worth of bodywork That seems still less than a surgery, but what I'm saying is that, and that's over time, but that's not the only thing that's going to benefit. All of a sudden the chest is, you get better breathing, better digestion, better, everything is better aligned. That old knee problem starting to get better. We avoid the bone on bone that's that's going to happen as we get older. So there's a long-term benefit to that. Okay, so check out or look into structural bodywork, Aston-Patterning. Give you a link on that one as well. And see if there's not very many of us, so you might have to fly in to come see me. Okay, so anyway, this is Pooch by Posture. This is what I mean by that. So hopefully this has made sense. Not necessarily giving you the answer you want to hear, but it's something to consider as part of this overall wellness to take care of your posture and as it relates to the skin. Okay, happy wellness. We'll see you tomorrow.